Back pain is one of the most reasons people go to the doctor or miss their work, and it's the leading cause of disability worldwide. It is a common ailment, and the older you get, the more likely you are to experience it. In fact, the majority of Americans will cope with back pain at some point in their lives. For a small percentage, back pain may become chronic, but with treatment, most episodes of back pain will resolve on their own. Occasionally, you will need help from your doctor in the form of prescription, medications, or injection. Surgery may be an option in very rare cases. Fortunately, you can take measures to prevent or relieve most back pain episodes. If prevention fails, simple home treatment and proper body mechanics often will heal your back within few weeks and keep it functional. And the good news for people who have experienced back pain and want to avoid another bout with it is that you can take steps to prevent back pain. Daily stretches, yoga, and strength training can help make your back and core muscles stronger. Back pain may be mild or extreme, quick or constant, but what raises your risk and what can you do about it? Welcome to Beyonce. Today, we'll be learning about back pain's causes, risk, prevention, and home remedies. Don't forget to subscribe to our channel and hit that notification bell so you'll always be updated on our future uploads. There's a lot riding on your spinal column. It's your body's main structural support. It needs to keep you stable enough to stand upright but flexible enough for movement. So it's no surprise that many people have back problems from time to time. There are several symptoms of back pain. It can range from the muscle aching to a shooting, burning, or stabbing sensation. In addition, the pain may radiate down your leg or worsen with bending, twisting, lifting, standing, or walking. Lower back pain is not a disorder. It is a symptom of several different types of medical problems. It usually results from a problem with one or more parts of the lower back, such as ligaments, muscles, nerves, or bony structures that make up the spine called vertebral bodies or vertebrae. It can also be due to a problem with nearby organs such as the kidneys. Now here are some common causes of back pain. We often bring on our back problems through bad habits such as poor posture, like sitting incorrectly at a desk or behind the steering wheel, repeating the same motion or overdoing it, pushing, pulling, and lifting things carelessly. Next may be a result from overactivity, strain. Strained muscles often cause back pain. It commonly occurs with incorrect lifting of heavy objects and sudden awkward movements. Then there's the structural problems. Vertebrae are interlocking bones stacked on top of one another that make up the spine. Discs are areas of tissue that cushion the space between each vertebra. Disc injuries are a fairly common cause of back pain. Sometimes this disc can bulge, herniate, or rupture. Nerves can get compressed when this happens. Arthritis. Spinal osteoarthritis is also a potential cause of back pain. It is caused by the damage and deterioration in the cartilage of joints in the lower back. Over time, this condition can lead to narrowing of the spinal column or the spinal stenosis. Next, osteoporosis. Loss of bone density and thinning of the bone, called osteoporosis, can lead to small fractures in your vertebrae. These fractures can cause serious pain and are referred to as compression fractures. Now, there are many other potential causes of back pain, but most of these are rare. Be sure to see your doctor if you experience regular back pain that does not go away. After ruling out the more common causes of back pain, your doctor will perform tests to determine if you have a rare cause. And this can include displacement of one vertebral body onto another, called degenerative spondylolisthesis, loss of nerve function at the lower spinal cord, called cauda-equina syndrome, a medical emergency, fungal or bacterial infection of the spine, cancer or non-malignant tumor in the spine, kidney infection, or kidney stones. Then one of the more common types of back pain comes from straining the bands of muscles surrounding the spine. It happens most often in the curve of the low back and the base of the neck. Pregnancy also often brings back pain too. Uncontrolled peeing or pooping could mean a serious problem like spinal cord compression. Call your doctor right away. Sometimes your back may be painful for no clear reason, and that is called non-specific backache. It could come from weak muscles that cannot handle every walking, bending, and stretching. A urinary tract infection may also cause back pain. It is an infection in the parts of your body that are responsible for carrying urine. This could be the kidneys, ureters, urethra, or the bladder. A UTI is most often caused by microbes or bacteria that enter the urinary tract and multiply. The spine is actually a stock of 24 bones called vertebrae. A healthy spine is S-shaped when viewed from the side. It curves back at your shoulders and inward at your neck and small of your back. It houses and protects your spinal cord, the network of nerves that transmit feeling and control movement throughout your entire body. Back pain, whether a dull ache or shooting, is just one sign that something is going on with your back. You might also have feelings in your legs and arms like radiating pain, numbness, tingling, weakness. Anyone can develop back pain, even children and teens, but these factors might put you at greater risk of developing back pain. Number 1. Your age. Back pain is more common as you get older, starting around age 30 or 40. Number 2. Lack of exercise. Weak, unused muscles in your back and abdomen might lead to back pain. Number 3. Excess weight. Obesity and excess body weight puts extra stress on your back. Number 4. Diseases. This is if you have been diagnosed with a specific condition like arthritis. Number 5. Improper lifting. Using your back instead of your legs can lead to back pain. This also occurs if you engage in high-impact activity without stretching or warming up first. Number 6. Physiological conditions. Your emotional health also has an effect on your risk for back pain, and you may be at higher risk for back pain if you have a stressful job or depression and anxiety. And number 7. Smoking. Smokers have increased rates of back pain. This may occur because smoking prompts more coughing, which can lead to herniated disc. Smoking can also decrease blood flow to the spine and increase the risk of osteoporosis. Now, what are the ways to treat back pain? The majority of back pain episodes are relieved by treatment with non-steroidal anti-inflammatory medications. Pain relievers or analgesics are also an option, though they don't have the anti-inflammatory properties. Be careful with some medications if you have kidney problems or stomach ulcers. Never take more than the recommended dose of over-the-counter medications without talking to a doctor, as even these medications may have severe effects if taken incorrectly. There are also alternative therapies that may also help relieve back pain, and this includes acupuncture, massage, chiropractic adjustments, cognitive behavioral therapy, and relaxation techniques. Be sure to talk to your doctor before undergoing any alternative or complementary treatment. If you're experiencing back pain, these lower back pain treatment options might be helpful. And here are some tips on back pain home remedies. Many home remedies can be used with traditional back pain treatments. If you have questions about this, talk to your doctor. Number 1. Heat or ice therapy. Ice packs may relieve discomfort and help lessen inflammation in acute phases of back pain. Note not to apply the ice directly to your skin. Wrap it in a thin towel to prevent damage to your skin. Warm compresses may also relieve pain when inflammation has subsided. Consider alternating between heat and cold. Number 2. Exercise. Exercise to improve posture and strengthen the muscles of the back and abdominal muscles, called the core muscles, is a treatment option that should be strongly considered. This treatment often involves improving posture, using proper lifting techniques, strengthening core muscles, and stretching muscles to improve flexibility. A physical therapist can teach you on how to perform these types of exercises at home. Number 3. Essential oils. Research suggests that lavender essential oil or ointments made with capsaicin may help decrease the pain. Capsaicin is the ingredient in peppers that make them hot. These ingredients may desensitize the nerves in the impacted area and decrease the pain you feel. And number 4. Salt bath. A hot bath can do wonders for aching muscles, but while you're soaking, give the water an added boost for your back with Epsom salt. Your body can absorb the minerals from the salt bath and they can help ease aching muscles. Now, how would you prevent back pain? It is by improving your physical condition and learning and practicing proper body mechanics. Carry less. Heavy briefcases, laptop bags, and suitcases can add unnecessary stress and strain to your neck and spine. Try to reduce what you need to carry and use bags that distribute the weight more evenly, such as backpack. Work your core. The muscles in and around your abdomen and back help keep you upright and carry you through the physical activities. Strengthening them can also reduce the chances of pain, strain, and damage to your back. Improve your posture. Poor posture can put unnecessary pressure and strain on your spine. Over time, this can lead to pain and damage. Regularly remind yourself to roll back rounded shoulders and sit upright in your chair. Next, change your shoes. High-heeled shoes are likely to cause damage to your back if you wear them frequently. Pick comfortable, low-heeled shoes when you can. 1 inch is a maximum heel height suggestion. And our last tip, stretch often. Doing the same thing every day can leave your muscles fatigued and more apt to strain. Stretch regularly to help improve circulation in those muscles and lower the risk of back pain and damage. Most back pain gradually improves with home treatment and self-care, usually within few weeks. But contact your doctor if the situation of your back pain persists past a few weeks, if it is severe and doesn't improve with rest, if it spreads down one or both legs, especially if the pain extends below the knee, if it causes weakness, numbness, or tingling in one or both legs, and if it is accompanied by unexplained weight loss. According to the American Association of Neurological Surgeons, 75 to 85% of Americans will experience back pain in their lifetime. Of those, 50% will have more than one episode within a year. In 90% of all cases, the pain gets better without surgery. Have you experienced any serious back pain before? Share us in the comments below. If you think these tips are helpful for preventing back pain, give us the big thumbs up. Subscribe to our channel and hit the notification bell so you'll always be updated whenever we upload helpful videos like this one. And remember, sharing is just one click away.